Hello and welcome to my YouTube channel. This video is specifically for the Thin Endometrium Facebook support group because they helped me so much when I was struggling with issues with thin endometrium. I'm going to go through all the things I've done personally that helped me finally manage my thin endometrium and achieve a pregnancy. So if that's something that you want to hear, just stick around and I'll go through everything in detail. A little bit about me. My name is Dr. Summer and I have been a clinical embryologist for 14 years. I've also been an IVF patient for a number of years. So let's dive in. I'm just going to start with some background information about my fertility, how I think I developed a thin endometrium and what I did to solve it. So the first time I got pregnant, I was 23. I was actually on the pill, but I was traveling a lot and I wasn't very consistent on taking it on time. So I managed to get pregnant on the pill. I then put a Mirena IUD coil in for around a year and a half or 2 years. Then I removed it to try have a second baby. The year after I removed the Mirena coil, I had 4 miscarriages. The first miscarriage was a blighted ovum. The second one I discovered around the 12-week mark that I'd miscarried. The baby had stopped growing at 9 weeks. And the third and fourth miscarriage were early miscarriages. I had a bleed before the 6-week ultrasound. After that, the 5th pregnancy resulted in my second baby. After the second baby, I put the Mirena IUD coil in and I had that in for, I'd say, around 10 years. So skip a few, the relationship I was in my 20s had ended and I'd met someone else and discussed that we'd want to try to have a baby together. I removed the IUD coil and I started getting my periods. During the time where I had the Mirena coil in, I didn't have regular periods. Sometimes I get spotting. I probably have 1 or 2 periods a year. And then for the last 5 years when I had the coil in, I didn't have any periods, no bleeding, no spotting at all. I removed the IUD coil and I started getting regular periods again. My periods have always been regular, always been every 28 days. However, the periods were very different to how I normally had periods before I put the coil in. They'd last 24 to 48 hours. They were very, very light. I didn't really think anything of it. So as an embryologist, when my now husband was like, oh, we want to have kids, I was like, okay, maybe you should get your semen tested, because I knew I had able to conceive before. So I was like, you can try, you get tested just in case there's any issues. We don't want to like dilly-dally, because I was 36 at the time. So he went and got a semen tested and it came back with teratozoospermia, which means the morphology was quite poor and the motility was very poor. So when I looked at the report, I knew straight away we'd need EXI. So I was working in Ireland at the time, and after my contract ends, we'll have a go, because I don't think I want to be working in the lab where I would have my cycle done. So after my contract ended, we did an IVF cycle and I managed to produce 17 eggs. 14 of them were mature, 7 fertilized normally, and on day 5 I had, I think, 5 day 5 blastocysts. So initially we wanted to do a fresh transfer. So I did an ultrasound to see if I had any fluid, and that's when they discovered that my endometrium was very thin. It wasn't really an issue I thought would come up, because I'd never really met or seen a lot of cases in the clinic which suffered from thin endometrium. I think I've only seen 1 or 2 during the 14 years that I worked as an embryologist. An ultrasound on the day of transfer, and they told me your endometrium was too thin to have a transfer. I think it was 3.6, maybe 4. So I was like, okay, we'll freeze all the embryos and I'll try to thicken my endometrium. I didn't really know that it was hard to thicken a thin endometrium. I was still fresh to everything. I just thought that the medication maybe affected me, and if I had a normal cycle without the medication, my endometrium would thicken naturally. So the next cycle I did an ultrasound on day 14 to see how thick my endometrium was, and it was still quite thin. I think it was at 4. So then the cycle after that, I did a medicated cycle. So basically they just gave me estrogen to see if my body would respond, and it didn't. It was still 4.5 mils. So then they gave me a double dose of estrogen the cycle after that, and my endometrium was still thin. That's when I decided to do a hysteroscopy to see if there were any adhesions, anything that could have caused my thin endometrium. So I did a hysteroscopy and it showed that I had areas of atrophy in my endometrium, and I was in Egypt at the time, so then they said maybe you could try a PRP. So I did a hysteroscopy with PRP injection. It didn't work. The month after that I did a PRP wash with the medication, the high dose of estrogen. That didn't work as well. So at the time I was doing my master's in public health, and because the university had given me access to a lot of websites where scientific journals were published, I managed to do extensive research, a bit too obsessively. Like I'd wake up at 6 a.m. and just obsessively read over every single study that had been conducted on thin endometriums, and there was different protocols with different results. There was a couple of protocols with high estrogen, high tamoxifen and Viagra. So I managed to convince the doctors to get me prescription for the meds to see if maybe different medications would have different results. So I did 1 month of estrogen, tamoxifen and Viagra. My endometrium I think went up to 5, but I didn't achieve a trilaminar. And then I did it again with PRP. It also didn't achieve a trilaminar, and it was always stuck at 4.5 or 5 millimeters maximum. So this went on for, I'd say 7 or 8 months. I was doing back-to-back cycles where I was just trying to thicken up my endometrium, and nothing worked. So after 8 months, obviously I was very depressed. I started looking into surrogacy. I was like, oh my God, this is so tough. I can't even get to the point where I have an embryo transferred, and then maybe I could get pregnant, maybe I couldn't. I was a bit like jealous of people who had multiple transfers, even if they didn't work, because I was like, I'd rather have a couple of transfers in the hope something works, but I can't even get to the finish line where I am eligible for a transfer. I found it very tough. And at that time, I started studying to become a fertility coach, because I didn't realize how difficult fertility journeys were. And I just wanted to help people who were in similar situations. I just felt nobody understood how I was feeling. Everyone was kind of dismissive. All the doctors were dismissive. They were telling me it was because of my age. I was 36 or 37 at the time, and I just knew it wasn't my age, because I had an IVF cycle done. I produced 17 eggs, 14 were good. I had 5 out of 7 fertilized eggs produced blastocysts. My hormonal profiles were perfect for my age, and my AMH was good. So there wasn't anything to indicate that it was an age-related issue at all. It was just a thin endometrium. All the studies that were done on women with long-term use of progesterone IUDs, like the Mirena, they were all women who had only had it in for 3 to 5 years. There was no studies who had it on women who had it for more than 7 years. I had it for nearly 10 years, and I couldn't find any studies. There was only one paper I read that kind of hinted that maybe the Mirena was the cause, that a long-term use of the Mirena coil would just cause downregulation of the estrogen and progesterone receptors in the uterus. And that was the only kind of thing that I could see was causing an issue. Sorry. That could be why my body wasn't responding to any of the estrogen or the medication I was taking to try and thicken my endometrium. So after 7 or 8 cycles, I was very exhausted mentally and physically, so I decided to take a break. My friend had told me she went to an acupuncturist because she was having really bad sinus issues, and after a few sessions, her sinusitis cleared up basically. So I was like, okay, do you know what? I'll give acupuncture a go. So I did 4 to 5 sessions of acupuncture the month where I was taking no medication. And when I got my period that month, it was actually the first time I had a period that was similar to the periods I had before I'd started the Mirena. So I was like, okay, maybe this acupuncture is working. At the time, I went to Cyprus, and I was going to stay in Cyprus for a couple of months. So I had to change doctors and follow up with someone else to try and thicken my endometrium, because I really wanted to get a frozen embryo transfer done. So I went to a doctor in Cyprus, and he suggested I do something called a Neupogen wash, which is basically a granulocyte colony stimulating factor. It's an injection given to people with leukemia, but he just used it as an IUI to see if that could work to thicken my endometrium. And lo and behold, for the first time, my endometrium actually went up to, I think, 6.5, and it was trilaminar. So that was like a mock cycle I did to see if the Neupogen wash would work. I called the clinic in Ireland, and I was like, okay, I think I can manage to get my endometrium a bit thick. Can I schedule the next cycle for a frozen embryo transfer cycle? So they said yes. The next month I did 2 Neupogen washes, and my endometrium was thickened to around 6.5 mils. So I did my first transfer, and that failed. I wanted to take a break before doing another transfer, but logistically I was in the UK at the time, and it was just easier for me to try another cycle after that one, because going from the UK to Ireland was way easier from traveling from Cyprus and Egypt, where I usually live, to Ireland to do the embryo transfer. That was in August 2024, and I couldn't do the Neupogen wash with the doctors for this cycle because all of the clinics and most of the people take holiday in August. So I just had to do the normal protocol, which is high dose estrogen, and that was it. That was all I was taking to try and thicken up my endometrium. I remembered when I did the acupuncture, it did yield some results. So I was doing acupuncture every 2 days for that cycle. I was basically just driving up and down to all the acupuncture clinics in Cyprus, trying to get them to thicken my endometrium. So I went to the UK on day 11 and I continued doing acupuncture there. I met a really, really good acupuncturist in London, and I'm going to give all the details of everything in the description below, just in case anyone's in London and they want to see this acupuncturist or any of the things I've done have helped. So I went to this acupuncturist in London, and he was so understanding because I told him I have a potential transfer next week, can we do acupuncture daily? And he go out of his way and just come and see me to try and help me. And believe it or not, when I did the ultrasound to see if my lining had thickened that month, it was the thickest it ever had been in over a year. It went up to 9 millimeters and it was trilaminar. I'd never achieved that before. So I called the clinic up in Ireland and they were like, okay, you can do a transfer. I went to Ireland and I put 2 embryos back this time, and one of them stuck, and I managed to have a healthy baby. The pregnancy itself was very difficult because I had placenta accreta and complete placenta previa. I don't know if it was because I had a thin endometrium or it was because I was over 35, I had an IVF baby, and I had 2 previous C-sections. They're all kind of contributing factors for all the placental complications I had. That's just what happened. Also, the things I did that I think really helped thicken my endometrium was like the last 3 or 4 months before I had the positive pregnancy test, I really focused on having kind of a healthier lifestyle and taking supplements that would improve my endometrium. The first thing I did was take high dose vitamin E daily. I'll put all the links for everything I took in the description below, just in case anyone wants to do the same. I kind of had a kitchen sink approach where I was just chucking everything at this problem and hoping something worked. So I did a high dose vitamin E pill every day. I was taking high dose L-arginine because studies have shown that vitamin E and L-arginine do help thicken up endometrium. I was taking CoQ10 every single day, and I realized that my sleep quality was really bad. So I really focused on improving my sleep quality. I bought a Fitbit, and I was just being able to track my sleep quality, giving me some sort of accountability or tracking device to see how good my sleep was, really helped. I was taking magnesium supplements every night to help with sleep, and if I was really struggling with sleep, which I was a lot of the time because I was so stressed during this time, I would take a melatonin pill as well. I was prioritizing going to bed early and waking up early because the estrogen and progesterone receptors in your womb, basically they are affected by your circadian rhythm, so you just have to have a super clean, super healthy lifestyle. I was in Cyprus for the last couple of months, so I was naturally consuming a Mediterranean diet, a lot of halloumi, loads and loads of salads, loads of fruits like figs and pomegranates and all that stuff. I really think that helped. So I think that approach really helped me. I don't know, maybe it was my body just needed more time to get used to being off the Mirena. I don't know exactly what the cause is, but in my heart and my gut feeling, I just feel that the Mirena coil ruined my endometrium. I just think nobody really talks about the long-term effects, and I don't know if there's a lot of people who have been on it for a decade and then trying to conceive again. Maybe there are, maybe there aren't, but I do think any long-term use of contraceptives can adversely affect women's bodies, and there's not a lot of studies sadly done on it. There's massive gaps in the medical literature regarding this. So they're all the things I did to help thicken my endometrium. I really hope any of this helps anyone out there. I know it's so difficult and it takes a lot of mental strength to get through this. If anyone wants to reach out just to rant or talk or anything, please reach out to me. If you kind of like fertility related content and nutrition and lifestyle advice on how to improve your fertility, please like and subscribe. And if you know anyone that could benefit from this video, please share it with them as well. Let me know if there's anything else you guys want me to cover, and I'm more than happy to answer any questions at all. And I hope this helped you. Okay, bye.